Hello, everyone, and welcome back to our discussion today, which is diabetes. Now, diabetes is a metabolic disorder of the pancreas, and it affects carbohydrate, fat, and protein metabolism. No age group is exempt from diabetes. You see diabetes in all ages. Incidence is higher among persons ages 65 years and older. Because of the chronic nature of diabetes, people can experience debilitating and even life threatening complications before death. Older diabetic patients have a higher mortality rate, they have reduced functional status, and they are at increased risk for being placed in those long term care facilities. Being a pre diabetic patient can lead you to develop type 2 diabetes, as well as heart disease and stroke. Most of the time, people with pre-diabetes are overweight or obese. That puts them at risk. They have one or more abnormal blood glucose tests, such as a hemoglobin A1C, a fasting blood glucose, or an oral glucose tolerance test. During that pre-diabetic period, a person can delay or even avoid developing type 2 diabetes with weight loss and physical exercise and diet modification that can delay and even avoid the development of type 2 diabetes in the pre-diabetic patient. Type 1 diabetes is considered an autoimmune disorder. With type 1 diabetes, there is an absence of insulin production. There is a destruction of those beta cells, and because of that, no insulin is made at all in the diabetic type 1. There's no insulin made. So, type 1 diabetes has to receive insulin injection daily. And depending on how well they manage their insulin, and depends on the physician as to what type and how frequently they will receive those injections. But remember, type 1 diabetes is the absence of insulin production. Now, type 2 diabetes can be an inherited disorder, but it also can be obesity, especially that intra abdominal obesity, and that can be a trigger for the onset of diabetes type 2. So, your diabetes type 2 is the insulin resistance. So, insulin resistance, you have that lack of, or I should say, the insufficient production of insulin. You have an insufficient production of insulin, so you don't have the ability of the cells to respond to the insulin, making them insulin resistant. So, the type 2 diabetes is inherited, triggered by obesity, and there is an insufficient amount of insulin produced for this condition. You do see a correlation of obesity, sedentary lifestyle, and the insulin resistance to the development of your type 2 diabetes. So, oftentimes, getting diet, exercise, and weight loss under control can even delay or reduce the need for medication in the type 2 diabetic. Now, both forms of diabetes, the patients can feel hungry, which is polyphagia. They can also have increased urination, polyuria, and they can also have polydysmia, which is your extreme thirst. So you see this in both of your diabetic patients. They will also have some glycosuria, which is glucose in the urine. They can also experience ketomia, which is ketones in the urine as well. There are three classic symptoms associated with both type 1 and type 2 diabetes. And like I said, that's polyuria, polydipsia, and polyphagia. Additional symptoms include weight loss, weakness, thirst, fatigue, and dehydration. These signs and symptoms can be abrupt onset in your diabetics, your type 1 diabetics. With your type 2 diabetics, they're more of a gradual onset. Some of them also develop skin, urinary tract, and vaginal infections as well, related to the elevated blood glucose levels, which support the growth of bacteria. So, how do we go about diagnosing diabetes? Well, we look for at the urine, and we also look at blood. So, we look in the urine, we look for glucose and ketones. In the blood, we're looking at the blood glucose levels. An AccuCheck or a blood glucose level is the most accurate way to go about detecting your and monitoring your diabetic. The glycolated hemoglobin, also known as your hemoglobin A1C, is an excellent way to monitor the management of the blood sugar by the patient. So, hemoglobin A1C, you want that to be less than 7. And that tells you that the client has been managing their blood sugar quite well over the past 2 to 3 months. Anything over than that, over 7, lets you know that it's been inadequate and you need to do more teaching and probably more follow up and evaluation with that person with the elevated hemoglobin A1C. Now, treatment of diabetes depends on what type it is, and the ability of the pancreas to manufacture insulin as well. So, the treatment for diabetes can be diet, weight loss, exercise, insulin, oral anti diabetic agents, a pancreas transplant, or an islet cell transplant. These are some of your management for your diabetes, depending on the type. Diet and weight loss is by far a major treatment for every person with diabetes. So the better control of their diet, the less trouble they're going to have with their diabetes. So be sure to look in your ATI nutrition book. Chapter 15 has excellent resource there for the diabetic diet. Exercise is another good way to control that blood sugar. So know that whenever the more you exercise, that's the more calories you're going to burn, and you're going to need less insulin because of that, or less medication for that diabetes whenever you exercise more. So you have to be able to explain that hypoglycemia to that person who's has an exercise regimen they follow. So that basically tells us about prediabetes, diabetes type 1, and diabetes type 2. We discussed the diagnostics, the treatment, the nursing management, as well as the pathophysiology of this process.